So let's just kind of do show and tell of soft tissue shoulder masses. We'll kind of start out with some benign ones and then head to the malignant lesions. So Brian, why don't you take this one?
All right, there's a pre and post-contrast images of the shoulder. That side show a mass which doesn't have any obvious enhancements. Well circumscribed, so it has a component which is mostly within the subcute fat, so probably a sebaceous cyst or epidermoid.
Yeah, they just call it a cutaneous cyst. Okay, Philip?
A 49-year-old male with a slowly growing mass for 30 years. So it's another, it looks like it's a T1 hypo, fat sat hyperintense mass in the subcute tissues. Looks should be cystic, but I guess on T1, okay, so post-GAD demonstrates no enhancement, so also likely a benign sebaceous cyst.
Yeah, this was an epidermoid cyst.
Okay. 12-year-old with pain after trauma and calcium on plain films. Coronal and sagittal image of the shoulder demonstrates intraarticular loose bodies there, and
3/16/2000.
Okay. Trauma and pain. Okay, and then we see. Yeah. So synovial lost tooth.
And this is 2009.
So this was before. Oh, okay. So yeah, we're seeing some more loose bodies there. So yeah, synovial osteochondromatosis would be.
And that's big effusion as well.
Right. So that's the X-ray.
Brian?
I have an X-ray with multiple flocculent calcifications overlying what looks to be the subscap recess, and there's some in overlying the axillary pouch as well. So they're fairly small, uniform.
Oops. Sorry. Yep. So another case.
Would you consider tumoral calcinosis for the X-ray differential?
I think these are probably going to be inside the joint space.
Okay.
Yeah. Okay. Philip?
So we have actually images of the shoulder with a lot of hypointense mass, just kind of an axillary pouch or in the anterior. Yeah, so it kind of matches that radiograph we saw before. Multiple.
These are a little, okay. Yep. So that's also synovial chondromas. Okay.
Okay. So we have T1 post fat sat images of the shoulder, which demonstrate. So this looks like fluid outside of the joint in the bursa. I think in the subacromial subdeltoid bursa. So this looks like bursitis. There is yeah.
T2.
Okay, and then on the T2 there is low signal intensity loose bodies within it. So this looks like secondary osteochondromatosis, synovial osteochondromatosis as well.
Okay. Brian, here. Let's see. These are just studies on 2 different days.
Okay, so we see a rounded low signal body in the like the subscap recess on the first image, and on the second there's one in the posterior joint.
Yes.
This could be trauma of these bodies, or
Yeah. So it just shows it can move around. And then here's just a more degenerative disease with more irregularity, a single large loose body with irregular margins and sclerosis, more typical of degenerative disease. Probably has donor sites from over here on the humeral head, and then once they're in the joint space, they can grow over time. So that was just a post-traumatic loose body. Okay, Eric?
Yes, hello.
Okay, here you go. We got a case for you right here. It says your name written all over it.
All right. Ultrasound, 50-year-old female, left axillary mass, and there's a oval-shaped 6-centimeter mass in the axilla. Looks solid, and then an MRI also shows a solid-appearing mass in the axilla.
Yeah, but notice that.
Along the nervous.
Look at the signal characteristics. This is a T1 and this is a stir.
Yeah, it's sort of intermediate. It's somewhat similar to fat on the T1, but not on the stir. It doesn't suppress. It may be a little bit. So there may be some fatty content. Yeah.
And here you go. And
So
there.
this could be. It certainly could contain some fat. Could be a.
Yeah. If it were just a regular sarcoma, you'd expect it to be lower than fat. I mean, lower than at muscle or lower than muscle on the T1 weighted images. So it's a little bit of an odd thing. What do you think?
Well, it could be a liposarcoma. I mean, a lipoma doesn't have the typical lipoma look to it.
Okay.
Other things.
And here's another one.
That one is a little closer to fat signal, multiple sequences, but also not entirely typical. Okay, Hyperplasia.
So these were hymenomas. So they're benign, basically lipomas with brown fat, and you have to, I think, work up these kind of lesions. But these are relatively uniform in signal. They're kind of intermediate, and just remember that brown fat can have that kind of an appearance. All right. I don't know who's next. Brian, why don't you take this one? You read it?
I think it was Philip.
Supposed to be who?
Philip.
Oh, Philip? Okay, Philip, I guess.
A 19-year-old female with a mass. So it looks like there's an infiltrative mass within subcutaneous tissues, almost extending to the vessels and axilla. It doesn't sat out. Okay, so on that one, I guess it looks like it sets out a little bit. Maybe maybe that could be like ectopic breast glandular tissue.
Very good.
Okay, a 22-year-old female with aching pain for 12 weeks after a netball game. So we have two axial images of the shoulder demonstrate high signal within the infraspinatus and the supraspinatus tendons with heterogeneity in the muscles.
Yeah, I'm not sure we're seeing the tendons here.
Right.
We're just seeing the muscle.
Muscle, right. A lot of muscle edema is present. So this could be just muscle necrosis versus a severe case of strain.
You can see here at the infraspinatus is a little bit involved, but much less so.
Yeah.
And this was just an overuse injury.
Overuse injury.
So it's a really bad case. Well, it's really a muscle. I think you'd have to call this a muscle strain or tear at this point, since it's so old. Generally, if you have delayed onset muscle soreness syndrome, usually that peaks at around 48 hours, not many weeks like this. Okay, Brian?
Forearm swelling pain. Surgery a month ago. Uncontrolled diabetes. So we see ultrasound of the forearm, and there's some diffuse increased signal within the musculature. There's a rounded low signal that's kind of ill-defined area. It's fairly deep. And low attenuation on CT, so diabetic necrosis, and I saw some hair in there too. So diabetic minor necrosis would be pretty high on the list. Surgery a month ago, yeah, infection would be consideration too.
Okay. Eric?
Looks like multiple views near the shoulder showing a heterogeneous mass, low T1 and high T2, or both high T2 and low T2 signal characteristics. It's hard to really place. This may be somewhat superficial. I guess on the sagittal and axial images, maybe involving some of the bursal space, also maybe the recess, this subscapular end.
Sorry about that. Okay. So this turned out to be pigmented villonodular synovitis in the subscapularis bursa. Okay. Philip.
Painful swelling for 2 months. So, let's see, there's a lot of fluid and synovial thickening within the biceps, biceps groove, and kind of extending upwards extending through the rotator interval. And there may be some erosive changes in edges and bone. The anterior labrum doesn't look too good. So again, I'd be thinking about like the synovial process, like PVNS.
Okay.
Axial and sagittal images from an MR demonstrate a heterogeneous mass anterior to the subscapularis, which demonstrates peripheral enhancement. Again, I think this looks like synovial thickening with probably a PVNS.
Yeah, but it's very inhomogeneous here, more so than I typically see. You said
Right.
typically see with PVNS, and we're not seeing a lot of low signal in the T2. But this was, they
PVNS.
operated this was PVNS, very mass-like. Just looking at this without a history, I'd be more concerned about a sarcoma. Okay, Brian.
All right, so axial and MR images showing kind of a ill-defined or just kind of chunky synovial thickening and little strands of what looks to be synovitis in the joint space. So this looks to be a severe synovitic process.
Yeah, but it's pretty low in signal intensity on.
Some areas of,
Yeah, it's awfully low in signal intensity.
yeah, so low signal could be from
And it's really kind of a diffuse process, and it's likely that this would be in other joints as well. Yeah. And the patient had chronic renal failure. Okay, Eric.
This is a radiograph of the chest showing some opacification in the axillary region, somewhat rounded, multilobular, possibly calcific mass, and then the MR very low signal intensity, so it does suggest calcifications. This looks pretty coarse. Maybe some could be sequelae of hemorrhage,
Okay.
calcific adenopathy. Although this may be in the joint itself, which would,
Well, yeah, it may involve the subscapularis muscle here too.
mm-hmm. So calcific tendinosis, pretty severe. Calcific tendinopathy. Okay.
Yeah. It turned out this patient had scleroderma, and you can get calcifications certainly within the skin, but also within other muscles and soft tissues in scleroderma. Notice how much atrophy you have of the other rotator cuff muscles, and all this calcification and a kind of hypertrophy of the subscapularis that's involved, probably from chronic inflammation. Philip.
Left arm mass. So let's see. So there's a mass within the anterior musculature of the upper extremity, kind of with a central dot sign and a split fat sign.
Okay.
So I'd be worried about like a peripheral, like a Schwannoma or some type of like neurofibroma or something. Okay.
Yeah. Again, a lot of these, I think Schwannoma would be a good one, just looking at this. Though the margins are usually a little bit sharper, it's usually more oval. You usually don't get this edema within the soft tissues. But still, it looks like a little bit like a target sign here, so I certainly would think about Schwannoma. But then it'd be a little bit hard to explain the edema around it unless it's turned malignant and is growing or something. But nodular fasciitis can really look like very bad things. This is one example. I'll show some other examples because it has differing appearances, and it isn't always low signal intensity like you would like a fibrous lesion to be. So just some information from Dr. Sue. And differential down here is really the benign neurotumors like we just talked about. Fibrous histiocytoma, soft tissue sarcomas, myositis ossificans, the list can go on. Here's a 15-year-old male.
Okay. So this is the region of the upper arm or lower arm, demonstrates a big mass, which is low on T1, and it's bright on the fluid-weighted images, and so it's pretty big. In a 15-year-old soft tissue mass, I would be concerned for a sarcoma. I'm trying to see if there's anything characteristic about this lesion. Yeah, nodular fasciitis. Okay.
I'd be concerned that this is a malignant lesion, even maybe a little bit of rhabdomyosarcoma or some of those, but this turned out to be a benign lesion. So, yeah, got to work with the pathologist. Yes?
The previous image you showed, some of the erosions on the bone, can sarcomas do that, or would that favor a benign process?
It would favor more of a benign process. That's a good, very good observation. Sarcomas usually are too rapidly growing. Instead of getting remodeling like that, you get more of a destructive, invasive pattern. So I think that's a good observation. Looks like there's been some surgery here with some little metal artifact there too. Okay, Brian.
All right, so we have radiographs of the hand showing soft tissue mass, and it's slightly hypo-intense to fat, but it's hypo-intense to muscle. It's hyper-intense on, I guess this is
It's probably, yeah.
And I'm not really seeing the extensor tendon very well. So a giant cell tumor of the tendon tube would be really big. Could do this.
Yeah. Again, I think a lot of things could do it. The fact that it's as low as it is on the T1 weighted image, but it gets bright, so I think this could be a lot of different patterns. Certainly, it's something that I think you'd have to be very concerned about. It is large without necessarily a lot of involvement of the bone, but I would certainly be concerned about a malignant lesion here, though this turned out to be benign. Eric?
19-year-old male arm mass for 3 years. Looks like some heterogeneity in this mass. It seems to be intramuscular, or maybe primarily intramuscular adjacent to the musculature. Again, this could be nodular fasciitis. Other things, fibromas, I guess they're in the muscle, but CT also showing some low attenuation within the musculature. Fibromatosis.
Yeah. Yeah, the deeper ones, especially if they're more central, tend to be more likely to be malignant. Okay, Philip?
mass extending within the musculature, invading the musculature, and kind of outwards towards the subcutaneous tissue. And it does not saturate with fat saturation.
And it has this dense low signal, looks like a fibrous band, and that kind of on the fat suppressed images, that kind of modeled pattern that we've seen in some of these other ones. You can see it kind of blends in with the muscle.
Yeah, so this is another type of fibromatosis.
Okay. 33-year-old with a right upper arm mass. So plain radiograph demonstrating increased density and calcifications along the upper anterior arm. So on the MR images, there is a kind of a poorly demarcated mass, which is low on T1 and demonstrates enhancement. And
Really speculated.
it's very speculated, right? And the aggressive fibromatosis, right?
Yeah, these are just more aggressive lesions. And Brian?
23-year-old female, history of IV corticosteroid use. So we see a very ill-defined, fairly diffuse area of our mass or abnormal muscle signal throughout the posterior aspect of the upper forearm. Same thing, I guess.
I think this should be 06 down here. Okay. More of the same.
Obscurities of low signal. So this could be another fibrous process such as fibromatosis.
Yep. Okay. Go ahead.
This 20-year-old weightlifter, MR axials, T1 weighted, without GAD, showing an enhancing mass in the lateral deltoid muscle.
This must be a veil patient.
Okay. This could be related to an injection, granuloma or infection, but it is quite solidly enhancing.
Well, yeah, I think this is without GAD and this is with GAD.
Okay, so it doesn't necessarily.
There's a little bit of enhancement, but it's not really that marked.
Fibromatosis again.
See this kind of now. This one I'd be a little bit concerned. I'd get a plain film to see whether these are phleboliths and evaluating, though it doesn't really have quite as much septa going into it as a typical hemangioma. But you can have this. Certainly could be a hemangioma, so I would certainly get an X-ray. But this turned out to all be fibrous tissue. Okay, getting tired of fibromas. Okay, Philip.
So it's kind of a round soft tissue mass within it's like the triceps muscle, and it also has a split fat sign and remains hypointense. It's hypointense on the fat side and the. Let's see.
Okay, this turned out to be a cavernous hemangioma.
All these solid soft tissue masses, you can't really be confident that they're benign.
That's correct. That's correct.
They need to be biopsied anyway.
Yes, almost all of them will be. Some of them, if they're typical hemangiomas with the fat going into it in septa, especially if you have phleboliths, you can feel comfortable with. Lipomas that are completely lipid without any nodular areas within them, we can feel comfortable in. But most of the things in between that, they're going to have to be evaluated, and you're going to have to make a tissue diagnosis.
Okay, so there is another mass in the soft tissues that's low on T1 with some high signal within it on the T1 weighted image, and some low signal on the T2 weighted image within it. So this could be a hemangioma by the look of it, but I would like to get a plain film to see if there are calcifications, and there are, so this looks like a hemangioma. Is it enlarging
This
hemangioma, right?
is actually enlarging, so these can enlarge over time. You can see multiple phleboliths in them. Again, remember, we're using the kind of generic term hemangioma here rather than the specific term. This would be more of a low-flow malformation use of the word. All righty. Brian.
Okay, 26-year-old male, axillary mass for 10 days. See a really similar signal on all sequences, intermediate signal mass.
Sorry.
Wouldn't guess that right away.
Yeah, it's kind of uniform. All righty, Eric.
Okay, coronal MRs T1, T2, also showing a low T1, high T2 signal mass in the possibly the biceps. Maybe this is the triceps. I'm not sure which muscle. With some expansion, looks like it's the triceps, and some low signal intensity centrally. So a soft tissue mass. You could consider a hematoma that's undergoing some remodeling or Schwannoma.
Yep. Yeah, this turned out to be a Schwannoma, and I guess this is a little bit of a target sign. But I think this is one you'd have to have a differential, and you don't really clearly see the thickened nerve going in and out of it. And it's a little bit more inhomogeneous than Schwannomas usually are. And usually the target sign is in the center, and it's not as well demarcated as this. So it's not typical for Schwannoma. Philip?
Right shoulder pain. So within the, let's see, it looks like there's an infiltrated mass kind of invading the posterior musculature, just deep to the, just inferior to the scapula. It's also extending kind of to the, so that's the latissimus, huh? Really. It looks hyperintense on T2, isointense on, isointense on T1. Let's see, I guess I'm pretty worried about maybe like a sarcoma, myosarcoma.
I think we're in the neurotumor section.
I have no clue. A plexiform neurofibroma, maybe?
There you go. Yeah, that kind of infiltrated type appearance growing along there. Good. Okay.
So rapidly increasing shoulder mass in a 23-year-old female with NF1. So there is a pretty well demarcated mass adjacent to the vertebral body, which is very high on T2 with central low signal characteristics. I'm trying to spot it on the T1, I guess.
Well, I think there are some other things here on the T.
Okay, so this could, so this could be just a neurofibroma with multiple neurofibromas. Could also be a Schwannoma. Okay.
Big enough for you?
Yeah, that's big. Yeah. Neurofibrosarcoma. Okay. Yeah.
Again, it's very inhomogeneous, and it's, it really fits in that over 5 centimeter category. You have to be very concerned about this kind of a lesion. Okay, Brian?
Bilateral chronic scapular pain. We see a left side more prominent than right masses, which are have some fat content and a fairly characteristic location and appearance for an elastic fibroma. Let's go with that.
Yep. Eric?
50-year-old male, multiple MR and CT images showing a low density and high T2 signal mass, also with some heterogeneity and peripheral enhancement situated deep to the, or in the deep musculature of the shoulder. And this doesn't have the typical look of an elastofibroma.
No.
It's sort of more rounded, mass-like. And this could be another nerve sheath tumor, or could be a sarcoma of some kind, or
It's very low,
sarcoma.
very low in density. It looks like water on the CT. Kind of bright on the fluid-sensitive images, dark on the T1s. It looks like it's in the muscle.
Mm-hmm.
That's
Could
what it
be a
looks like.
sequelae of a hematoma as well.
Okay. This was an intramuscular myxoma, so it was a sarcoma. Just again, remember that one of the tumor that can look very cystic-like in the muscles is the myxomatous sarcoma. We saw that in some other muscles. Sometimes they can have septa in them. Often they'll only have a rim enhancement, just like a cyst. So these low-density lesions in the muscles, you have to be very suspicious that they're not benign. And this was a malignant myxosarcoma. Okay. Philip?
Tissue bulging at right subclavian area. Let's see. So it looks like that's what we have. There's a soft tissue mass kind of lifting up the pectoralis muscle. And it looks like, you know what? Is there something in the scapula too?
I don't know.
Okay. So it's solid, there's internal flow. So some type of something like myxoma or...
Yeah, it's kind of a low density. This turned out to be a lipoblastoma. Here it's low density, but this looks much dirtier than the myxoma that we saw before. But it's low density probably because of the fat within the within it. Even though on a MR scan, you know, maybe it's a little bit brighter on the T1 weighted image, but that's really hard to say. But it's not well differentiated, so it tends to have less fat, and the fat is really more microscopic. Often these aren't even low dense on the CT. Okay, so it's usually infants. It's typically a benign lesion. Okay.
Okay, 67-year-old female with a big mass. So it has some high signal on the T1 weighted images. It's very heterogeneous, has mixed signal characteristics on T2, and demonstrates peripheral and some solid enhancement. In a 67-year-old female with fat, this looks concerning to me. I would be concerned for a liposarcoma. Yeah.
Okay, Brian?
41-year-old male, mass, deeply trapezius. It looks slightly hyperintense muscle in T1. It does have some slightly heterogeneous enhancement. Solid mass, and there's some calcifications associated with it on CT. So, myeloma could look like this. Sarcoma, yeah.
Yeah. Okay, Eric.
32-year-old female chest wall mass, 1 month, showing hypoechoic appearance, but there is some color flow, and an MR, also some mainly solid appearance with some pretty high signal, not as high as the myxoma we saw. So this could also be a liposarcoma.
Yeah, and it has internal structure very clearly demarcated here. And so this just turned out to be Castleman's disease, which is a benign lymph node hyperplasia. Can have several different kinds of cell types in it. As you can see, Some people think that this is due to chronic low-grade inflammatory process, but I think that the etiology is really really unknown. Okay, Philip.
Okay. 15-year-old, palpable mass for right arm, 10 years ago, mass excision at same site.
Uh-oh, I think.
So in the right arm. So there's kind of like a subcutaneous nodule overlying the greater tuberosity of the right arm, right where your arrow is. It looks like it has some T1 hyperintensity, so maybe there's some fat component. It's extending into the deltoid muscle, and it may or may not be enhancement. But given that it has some internal fatty structure, I think you're thinking about like a type of liposarcoma.
So this is endothelial hyperplasia, or what's called Masson's tumor. There, it's a benign lesion. That's why it's been there for so long, and it's just really a benign, another type of kind of benign vascular type tumor. Can have very different appearances on an MR examination.
Okay. 43-year-old with a palpable mass in the shoulder for 1 year, increasing size and pain. So sagittal and axial MR images. Heterogeneous mass on both T1 and T2 with some high signal on T1 demonstrates enhancement centrally, and peripherally axial stir, pretty high signal. Heterogeneous solid mass on ultrasound. Looks like, okay, I was going to say liposarcoma, but yeah.
Yeah, right. That to be another endothelial hyperplasia. Letting you know just how specific MR is for these masses. Okay. Brian.
Shoulder mass excision 2 weeks ago at clinic. X-ray. I don't know if I'm seeing a bump or not on the shoulder. It's the right-hand mass, that's MR. Adrenals in the muscle, and then there's something else up beside nausea on PET scan. That increased uptake. I'd be concerned about it infiltrating 3 to 5 in the areas of low signal. It's like something on that like here.
So this was an extracellular skeletal osteosarc. Though you don't really see a lot of matrix on the CT, but it was present on the pathology. Eric?
Okay, a 45-year-old male with a mass, 6 months, stirring T2 images. I think this is superior chest wall, perhaps?
Yeah, I think so too.
It's
up close to the shoulder.
Yeah, so lots of heterogeneity, a cystic area, but looks like also some solid component, pretty superficial, and some irregular enhancement after GAD. So I would also worry about something like a malignancy. It is kind of superficial, but a liposarcoma or MFH.
Philip?
Okay. I'm not sure if this is the same mass or not. So on the MR, there's kind of a heterogeneous mass within posterior subcutaneous tissues that I'm having trouble seeing on the CT.
Yeah, so did everybody else. And notice that there's only about a 7-week difference between the two.
Okay, so in 7 weeks, it'd be surprising for a malignancy to rise that fast. Maybe trauma?
There's the sagittal images. Doesn't really look like a hematoma.
No.
Very heterogeneous. And clinically, the mass grew over this period of time. They could palpate something before, but it markedly enlarged over the 7-week period. So the concern was, is it a growing hematoma? Could it be an abscess, but the patient really didn't have symptoms of infection, and there was no real trauma. But this is what it looked like, and it turned out to be lymphoma.
So these are two masses. Can you point to the mass on the sagittal?
Here?
This
There's
whole thing,
mass
and
there
two
and
right
there.
here.
Yeah,
Okay.
they're both part of the lesion.
Right axillary mass, 68-year-old female, pretty big mass, heterogeneous. Yeah, axillary extends to the superficial tissues as well. So this looks like a lymphoma again within the axillary lymph nodes, but just by the location. Yeah.
Brian?
Okay, a seminal skin mass, it's fairly isotential muscle on T1. There are some slightly irregular borders. It's heterogeneously high signal on T2. I don't definitely see a tract connecting it, and it doesn't look quite cystic. Gosh, this could be a liposarcoma. Got a vessel that looks like it's communicating with, so could be, I guess, a superficial lymph node that's inflamed. Could be a foreign body. I'm not sure. Hypertense on test, so probably one of
So this is a relatively rare skin lesion, Merkel cell carcinoma. Less common than melanoma, and melanoma is not that common, and it's one of the organelles of the skin, with the touch receptors. So it's a Merkel cell carcinoma. Okay.
63-year-old male, left upper arm palpable mass. It's kind of an ill-defined mass along some vessels of the upper arm, showing some vascularity on the ultrasound, and also on the MR, showing some low T1, high T2 signal. So this could be some type of, this could also be lymphoma or some other, but it seems to be, okay.
Yeah, a little bit of history that was left out here. So you can also have metastatic disease, which is what that was. Okay, Philip.
40-year-old male, axillary irritation and mass after running without adenopathy. So there's a kind of a heterogeneous complex mass.
Yeah, I think this would bother you if you ran a lot.
Yeah. It's kind of below the brachial plexus and axilla. I guess it may or may not enhance. I can't tell. I'm wondering if we're in the met section, so.
Okay. We saw this lesion, and we actually suggested the cell type from the MR. So if you notice here, it's kind of bright on the T1 weighted image, which makes you think of fat, but it's very inhomogeneous on the T2. Oops, I'm sorry, this is the wrong one.
Oh!
Sorry about that. Here's the T1. It's on the T2. You have some areas that are low in signal. On the T1 post, well, let's see. There should be this isn't it. Well, I guess it is. Yeah. Here's the T1 pre. Notice it's bright. No, that's T1 fat site pre. On the T1 fat sat pre, which made us think that there may be some elements in it that have low, that shorten the T1 time. There's a little bit of inhomogeneous enhancement, but not a lot. But it was areas that were pretty low in signal intensity on the T2. So it really didn't look like the high signal was from fat. So the question here then, what might be inside a mass like this that would cause bright signal intensity on the T1 that's really not, doesn't really look like it's hemorrhage so much, and it's not fat.
Melanoma. We brought on T1.
Okay, there it is. And that was the question that we asked. They hadn't considered that, and they went back and they got further history, and they found out that the patient had a melanoma resected 7 years earlier that the doctors treating the patient didn't know about. And this turned out to be recurrent melanoma. All right. Well, that's soft tissue masses of the shoulder. Tomorrow maybe we'll try to do bone masses of the shoulder, and then we'll just have a few lectures about masses in the hand and wrist. Okay?
All right, thanks, Dr. Chris.
Thanks. Bye.
Thanks very much.
Yep.
Thanks.